guys, welcome to CHD Wise tonight. We are so excited to have you guys here. We just want to go over a few housekeeping items before we get started. We will have a question and answer session at the end of this webinar. And so throughout the presentation, feel free to click on the Q&A box and submit your questions. We ask that you keep your questions general and do not put any personal medical information into those Q&A boxes because it can be seen by everyone. And I will go ahead and pass it over to Sydney.
Hi, good evening. I'm Sydney Philpott-Strife. I'm here on behalf of OAF, and I'm really excited to, welcome our speaker for this evening, Dr. Leslie Davis. She is a multi-award winning licensed clinical professional counselor who specializes in relationship therapy. She's located and licensed in Illinois and Missouri. She has been a wonderful supporter of mental health work for single moms, as well as a variety of other individuals and families. She serves on the board of Ollie Hinkle Heart Foundation and really is focused on empowering women in her community. And she is also a heart mom, which I think she will share a little bit about her story tonight with all of you. So, Carissa, unless you have anything else, I'll turn it over to Dr. Davis to get started.
Thank you, Sydney. Let me get my presentation shared just a second. Okay. Can you guys see that? I'll make sure that's working. Okay, so we're going to be talking about relationship dynamics in heart families specifically, and learning how to support the parents, siblings, and each other. So Sydney did give a little introduction of myself. So I am a licensed clinical professional counselor, speaker, author, and the podcast host of She Matters. I'm also a Cadre contributor, which is a new mental health app that creates community for people that want to learn how to support themselves in different ways. I'm also the founder of She Matters and a board member of Ollie Hinkle. And special announcement, I am also a heart mom, and this is my heart warrior, Judah. So Judah was born with hypoplastic left heart syndrome, and he's had 4 open heart surgeries and numerous cardiac catheterizations, but he currently has a pacemaker as of the last couple of years. He's about to be 21, which I can't believe. It's scary to know that I have someone that's a full-grown adult and a heart warrior, but he will be finishing up his degree in human services in May. And I always think about proud moments for him and me being his heart mom. So when he was a senior in high school, he was in the marching band with O'Fallon Township High School, and they were in the Rose Bowl parade, and Judah is a percussionist. And surprisingly, we all thought that he was just going to be able to march just maybe a mile because of his heart condition and how stressful it was going to be, but he pushed himself in that parade and marched the entire parade. And that was a proud moment for him, for me, and all of his friends in the band as well. So this is what we're going to be talking about today. I'm going to go over what the emotional and relational impacts of having a child with CHD. And if you are a heart family, you know exactly what I'm talking about, but I just want you to know that you're not alone in that experience. We'll look at how it impacts couples, single parents, and siblings, and some of the challenges for each group there. And we'll look at some strategies for medical providers, family members, and friends to support those who are struggling with these. So before I get into it, I just want you to realize that you are not alone. If you are a heart family or heart warrior, you are strong and you are resilient. So let's talk about how does it feel to be a heart family. When there's a heart warrior in your family, it can increase your anxiety. If you've already dealt with anxiety, depression individually, having a heart warrior will increase that anxiety and depression. If you never had it, you might start to develop some symptoms of anxiety and depression. It can really create some mental health struggles. And one of the great opportunities I had was working in the Heart Center at Children's Hospital in St. Louis and being able to support the heart families there that really struggled with their child being hospitalized. Most of them were babies, but seeing the experience of them going through anxiety, depression, I'm sharing personally here, it did bring me back to moments where I may have been depressed and didn't know because I didn't know the signs. So being a licensed professional counselor, I was able to help those families recognize their symptoms and recognize that it's not uncommon, there was help for them. And so I want you to also know that this is a common experience if you're feeling anxious or depressed. Another thing that might happen, you might experience what's called survivor's guilt. So when you have a heart warrior and you see the child, or maybe it's their sibling, struggling with their health and with their life and all the struggles that they go through on their own, when you don't have those same struggles, you might experience what's called survivor's guilt. So you might feel bad that you are able to live life without having CHD. You might also experience blame. So blaming yourself and questioning, well, what did I do wrong for my child to be born this way? What did I do wrong for my child to have a heart condition? Most heart families, we don't always know the cause of our child having a CHD, and that can be confusing. And so we might start to blame ourselves and just to try to get comfort and understanding of why this has happened to our child. And overall, they're stressed and feeling overwhelmed. So heart parents often experience stress from receiving unhelpful help. So if you've ever had family members or friends try to tell you what to do or try to give you comfort that really wasn't what you needed in the moment, that unhelpful help can create more stress and more overwhelm because you're trying to kind of deal with their stress of not knowing how to help you. You might also feel judged for some of the decisions that you made about your heart warrior. Some people might, and this might be trigger warning here, you might experience judgment because you allowed your child to live. There are some people who may have made the choice to end a pregnancy when they found out that their child's heart was defective. But because you decided that you wanted your child to live, you might experience guilt and judgment for that. There's also, a lot of heart families deal with financial stress, and there's relationship stress, which we're going to get into. So let's look at families, parents. This is more for the married couples or those who are living together. So the emotional impact on parents, you might experience this high level of anxiety. There's stress, there's anxiety about fearing what's going to happen with your child. There might be anxiety of choices that you have to make, whether you have surgery or not. There's anxiety related to how do we manage all the things in our life if our child is in the hospital and we have kids at home. There's anxiety of what's going to happen to my job because I'm taking off work so much. And so that increased stress and anxiety will increase symptoms of anxiety, such as racing heart, or maybe you feel tension in your neck. You might experience headaches. You might experience stomach issues or trouble breathing. So those are some of the symptoms of anxiety. So pay attention to those. Another emotional impact is grief. So if we think about our heart warriors that are struggling with their life, that have developmental challenges, you might experience grief over what you thought your child's life should be like and having unmet expectations for their health in general. Maybe you had no idea that your heart warrior was going to be born this way. Maybe you found out after birth and all of a sudden there's complications with your child's heart. There is a experience of grief and loss that we have. And so this impacts couples in a different way because you may not know how to express what you're feeling, or you may feel this pressure of, I can't say that this hurts me so bad because I have to stay strong for my partner. There's also isolation and loneliness that we experience when there's a couple. Isolation may be due to frequent hospitalizations. So think about couples who have to split their time when their heart warrior is hospitalized and they have kids at home or the other person has to work. And you both, the way the hospitals are set up in the visiting rooms, there's not a lot of space for both parents to be there at the same time. And so you might feel isolated in your experience if you're the parent that's at bedside, where your partner is able to live their life somewhat normally and continue going to work or continue to go to family functions or hanging out with friends. Or if you have to flip-flop, you're not able to connect with each other. So isolation creeps in and loneliness also creeps in. So a few challenges for couples is just dealing with how to cope. Maybe you cope in different ways. Maybe one partner copes by trying to stay positive about the situation, where the other partner might struggle with, well, let's just keep it real. These are the facts about our heart warrior, and it's not looking good. And so you might have differences in your coping styles, which can create conflict in your relationship. There's also communication struggles and communicating about medical decisions. So maybe one person wants their child to have surgery where the other's like, let's try other options, or let's not do anything at all. And so if you're not on the same page about your heart warrior and their health and what's needed, that will create challenges in your relationship. You might also struggle with parenting styles. So when we have heart warriors that have developmental delays, you might want to be a little more lax when you're parenting. And maybe the other parent is saying, no, let's just treat them like a normal child, like everyone else. And so there's communication issues with how do we parent this child that has a heart condition and still meet their needs. There's also communication issues with long-term planning. So what do we do if one of us dies, and who does our heart warrior go to? You may not be on the same page. But one thing I have found when dealing with couples in general, whether you have a heart warrior or not, there are communication decreases when emotions get high. So if you're anxious, if you're feeling worried about things, if you're feeling tension with each other, sometimes communication stops. And that's when we have more issues in the relationship. And overall, there might just be stress. Stress can lead to emotional distance or conflict. When we don't cope the same way, some people turn inside and they get internalized with how they feel. They don't express how they feel, where maybe the other partner is very verbal and saying exactly how they feel, which can be triggering for each other. So keep that in mind. So what can you do about it? So here are a few strategies I want you to keep in mind. One is just be open and honest with how you're feeling. When we are able to express our feelings, not just by saying, oh, I'm sad and I'm mad, but if you give each other space to really sit with how you're feeling individually and you share that with each other, you are building connection with each other. And be open to sharing your perspective of what you think is right, what you don't like. There's space needed when you have to make decisions about your heart warrior. But if you can't be honest about how you feel about a decision being made, there's going to be more conflict there. Second strategy is if you feel like you can't manage this on your own, you don't know how to communicate, or you're just struggling over and over to communicate well, you can seek out therapy. Couples therapy is very beneficial, especially when you're dealing with your own stuff and now you have a child to worry about. Having someone in the middle can help you mediate the situation and help you hear each other better. So don't be afraid to get professional help to deal with your stress, with your grief, or any conflict that you're experiencing. And the last thing, and this is so important for couples who have a child in the hospital, but also at home, is to prioritize couple time. So you have to find moments where you can connect with each other. Let's think about if it's in the hospital setting. So you have a heart warrior in their room, and maybe the only thing you can do together is take a walk around the hospital. Maybe you go out and get coffee together. And that brief moment away from your child's room and away from all the noise and the beeping and the nurses and being bombarded with doctors, that's your time to connect with each other and really share, maybe how stressful, how scary this is, right? So if you have extended hospital stays, maybe you have a heart warrior that's been there for months, that does happen, or for several weeks. Sometimes you have to make sure you have time outside of the hospital setting as well. So maybe that looks like, let's create date night even in the hospital and get dinner together, or we walk down the street to a local neighborhood and get coffee together. But make sure that you're prioritizing that time with each other. So let's talk about the single parent experience. So I am a single mom. I've been a single mom during my child's entire life. And so I know a little bit about this part. And so the single mom experience or single parent experience, there's a lot of balancing we have to do. We're balancing appointments, we're balancing time at the hospital, and just regular everyday responsibilities. When we have to balance time at work, we have friends that we have to talk to, we have family members we need to keep updated. especially when we have to communicate with, let's say if it's single mom experience, communicating with our child's father and their family as well. A lot of back and forth that happens there. And that can lead to more stress and anxiety. We also experience financial stress. So how are we going to pay for all these medical bills, especially if we don't have good insurance, or if we have to leave our job because we have to be at bedside with our child? A lot of single parents struggle with this fear of losing their job if their child is hospitalized, especially back to back. And so keep that in mind if you know someone who is a single parent who has a heart warrior, that there is high levels of stress when it comes to finances. So I'll get into some ways to support them in a minute. But single parents also experience this emotional roller coaster. You know, some days you feel really great because your child is doing better. And there's some days when you're feeling at your worst because you don't know what's going on. There are single parents who, you know, depending on the relationship with the nursing staff or with the medical team, you may not even understand what's going on. You may not feel safe or comfortable to ask questions and get more information about what's happening with your heart warrior. And if you're the only parent that's present, no one else is there to help you with that. So dealing with the emotions of ups and downs. I remember times when I felt like I had to stay strong because I knew people were watching me and I knew that they were expecting me to be strong because I'm just a strong individual naturally. But when you have a child in the hospital, it's like your whole world stops. And so remembering moments when I could not cry in front of my son or in front of the doctors or the nurses, I had to really hold back emotional experiences. I could only cry in my car. Maybe I cried on the way home when I had to go change clothes, or maybe I was crying in a car in the parking lot when I pulled up just to get it out of my system so I can go into the hospital setting as a strong single mom. Single parents also experience judgment. Now, this can be judgment, and I've witnessed this and experienced this. Feeling judged by medical staff, by their friends and family, and sometimes by other heart parents. I remember when my son was younger and there was another single mom across the hall from where my son's room was, and that child was often left alone. I didn't know that parent situation. So all I remember thinking to myself was, why isn't his mom there? This kid is crying in the middle of the night saying they have to go use the bathroom and there's no one there but the nurses. Where's his mother? And come to find out later, you know, that mom was a single mom and she had other children at home, but she had no other help. So she had to go home and take care of those kids and just trust that the medical staff was going to take care of the child, her heart warrior that's in the hospital setting. So keep that in mind if you are a single parent, that yes, it is normal to feel that judgment by others. But if you are someone who knows a single parent, that be careful of how you're asking them questions of how they're doing, because that can be very triggering and trigger some feelings of judgment for them. So overall, the emotional impact that single parents may experience is loneliness. Again, being in the hospital with your child in that tiny room by yourself with your heart warrior, it can be lonely. And there's no other way for other people to stay overnight. It's usually only you. Maybe you're the only person going to all the appointments, you know, trying to answer all the questions that the doctors have. There's very limited social interaction throughout your heart warrior's life. So for example, maybe your child is the one that's not getting invited to birthday parties or to different events that their friends are going to because they can't do all the things that other kids are doing because of their heart. And so you're not getting invited, your child's not getting invited, so you're not getting invited, and you might feel lonely or feel like you're being isolated. And it's not by choice, it's just something that happens. There's also this loneliness we experience by having to make decisions alone, big decisions, like does my child have surgery or not? Does my child, are they allowed to do certain things at school? You know, how do I support my child? And not having that other parent support in making those big decisions. Single parents also experience guilt and confusion. So again, we don't always know the cause of our heart warriors conditions, but we might tend to blame the other parent if they're not around. Like, oh, it must be your father's fault. You know, maybe there's something in their side of the family that caused this heart problem for you. We don't really know, but we can go straight to blaming others. We might even blame ourselves for it. We might also struggle with trying to understand, well, how do I incorporate this other parent if they're not here, if they're in a whole nother state, or if they're just not wanting to be involved, but doctors are asking, what does the father have to say? Or we need consent from both parents. That can be a confusing time for single parents. And again, just the overall common experience of anxiety. But for single parents, there's a different level of anxiety that happens. There is fear of what could happen to your heart warrior if something happens to you. If you don't trust the other parent to be a good parent and to advocate for your child's health needs, well, what's going to happen to them when something happens to you? So that underlying fear is kind of lingers there sometimes. But there's also this fear. Remember, I talked about feeling judged before. There's a fear of DCFS or DFS involvement. So, for example, if your child is getting repeated hospital stays, or you would have to always talk to the nursing staff at the schools. If something happens and there are people in that child's life that are uneducated about the heart condition, you might fear being hotlined. Or if you are at the hospital and you can't stay with your child at bedside, you're afraid that, well, if I don't show up to these appointments, if I don't show up when they're calling and having medical staffings about my child, that they're going to think I'm not involved and I don't care, and they might hotline me. That is a real fear that single parents experience. So what can single parents do? One is build a huge community of support, whether it's with family, with friends, if it's a therapist, if it's a faith-based community. Having support is crucial, however you can get it. And sometimes there are spaces like Ali Hinkle Heart Foundation that will create spaces for you to connect with other heart families. Heart families get it. We get each other because we're all going through the same thing. Even if our children have different heart conditions, our experiences are very similar. And so if you are a single parent listening to this today, be mindful of there is support out there. You just have to find it. There are so many groups available online. And unfortunately, I didn't know of any of those support groups until my son was late in his teenage years, where I found a group for those who have hypoplastic left heart syndrome. And we also connected with someone that was somewhat close, I'd say about an hour away from us, but all his life, I never knew another child that had his condition. So experiencing that loneliness year after year, and him, feeling lonely that he's the only person he knows with his condition, we both needed support in different ways. I needed support as a parent, and he needed support as the person living with this condition. But we finally found it. And so I'm so grateful for the connections that we've made so far. The next thing you can do to cope is take care of you. So don't forget about you. It is so important that you take care of yourself and fill your own cup. It is so easy to step away from focusing on yourself if you feel selfish doing that. And a lot of times, our attention is just on our heart warriors' needs. So I remember, and I actually had to be told that I was doing this by my best friend. When I was reflecting on my son being younger in the hospital setting, my friend had to tell me, I had to make sure you ate something. I had to make sure you had on matching socks and shoes, because all you did was think about the baby. All you could do was watch him in the bed. And I don't remember any of that, but because I had that support, my support system was able to see when I wasn't doing well, when I didn't know that I wasn't doing well. Another thing you can do is therapy. So Ali Hinkle Heart Foundation is great about this and creating ways for heart families to get mental health support. And this is all around the country, and it's such a huge need. And again, my experience of giving therapy to other heart families was such a blessing to me, being a heart mom and being able to give back. It helped me see some things about myself that I didn't necessarily recognize because I was going through it. But therapy is crucial for single parents, because sometimes your therapist might be the only person you trust to be open and honest with about how you're really feeling. So let's move into the sibling experience. So I have no experience with this. I'm an only child. My son is an only child, but I have witnessed this in the hospital setting. So there are some siblings that struggle with feeling neglected. if their sibling has a heart condition, because that heart warrior typically is getting most of the attention. They also might feel anxious because they don't know how to interact with their sibling that has a heart condition, or they might be resentful because the other child is getting all the attention. So parents, if you have siblings that are maybe pulling away from you, maybe they're starting to shut down and get quiet, pay attention to that. Another thing to pay attention to with neglect is some kids will, we call it acting out, or maybe they're doing things to get your attention. So be mindful of, why are they doing that? Some siblings might experience guilt for feeling left out or not knowing much about their siblings' medical condition. So they're not going to the appointments. They're not going to the surgeries. So they may be at home feeling clueless of what's going on with their sibling. And they might feel anxious. So they might be anxious about their siblings' health and what could happen to them. Maybe they have this underlying anxiety that maybe there's something wrong with them too, and they just don't know. So be mindful of any questions that come up with other children in your family if they're experiencing the neglect, guilt, or anxiety. And here are just a few ways to help siblings. One is normalize their feelings. Talking about emotions is so crucial, especially if you have young ones. Teaching them, and we call it giving them an emotional word bank. So ask them, are you feeling sad about this? Are you mad for any reason? Are you angry? Are you nervous? Are you confused even? Help them identify what emotion they're experiencing and then normalize it. What they're feeling, you're probably feeling it too, and let them know. You don't have to be so strong with your kids and not express your own emotions. Being able to do that with them is great modeling behavior. So be able to normalize what they're feeling. The second thing is just involve them with care. Again, they're not going to the appointments, but you can fill them in afterwards, or maybe have the heart warrior explain, if they're old enough, to explain what's going on. What was their appointment like? Allow the siblings to ask questions. And if it's appropriate, if they can go to appointments or visit the sibling in the hospital, please do that. I think one benefit of St. Louis Children's Hospital in the Heart Center is they have professionals there that can help explain what's going on with the heart and explain what's going on. Even there's tubes coming out of this child's body, that they can normalize what they see, or even prepare them before they walk in the room and they see their sibling that may have just come out of surgery. So it doesn't have to be scary. We just have to prepare them for that. And the last thing is try to offer individual attention. So every kid needs this, whether there's a heart warrior in the family or not, is each child has different needs and they show up in different ways. So make sure you're spending time individually as much as possible with each sibling in the family, and letting them know how special they are too. So if you are a medical provider, I want you to pay attention. Medical providers are key to helping heart families heal, and they are key to helping them deal with the relationship issues. And you may not think that, but there was a study done, I believe it was 2018, that looked at the mental health needs of parents and mothers and fathers that have a heart child. And one thing that was helpful for those parents to cope was getting proper information that they understood from the medical team. So how do you do this? How do you give this information out? Well, one is to be empathic. You have to show empathy. So you may not be going through this experience, but you can try to put yourself in their shoes and what they might be dealing with. And as medical providers, all you might see is the parents in the bedside or at the appointments, and you don't see what their life is like outside of the medical setting. So offer that emotional support and validate any concerns that they might have. Their concerns might be as basic as, we don't know how to pay our light bill this month because we had to pay for a medical bill. It could be as simple as, we don't know how to get to this appointment because we don't have gas money. So if you hear these concerns that are not related to health, show some empathy. And if that was you, what would you want to be done? The second thing is just communicate. So communicate clearly. Give heart families all the information that they need. And sometimes I think about going above and beyond, because sometimes heart families don't know what questions to ask, or they don't feel comfortable asking. And so you can put yourself in the position to be mindful of that and just give them what you think you would want to hear if your child was the one that was a heart warrior. Also, if you see a single parent in the room, ask them about the other parent, or ask them if there's other people in that single parent's life that can support them, that maybe they need to invite them to the next appointment, because again, those single parents need that support all around. And if you can be the person that is the catalyst of helping them notice that they need that extra support, you can facilitate that for them. Which leads me to the last point, is be a connector. So knowing what services are available in your community or available online, that is your opportunity to connect families with the support they need, whether it's mental health support or for a support group, or if it's just thinking of faith-based things that they could benefit from. But keep in mind, last thing I have on here is to keep in mind the importance of being culturally competent. So if you are a provider and your patient and the patient's family does not look like you or does not speak the same language, be mindful of what does that family need to be able to understand what you're trying to tell them, and for them to get the support that makes sense for them. So if there are friends and family in this room today, these are some tips for you. And if you are the heart family, these are some tips you can give to your friends and family to help you feel more supported. One is, family and friends need to be practical and give practical help. So what does that look like? Offering food or childcare for the other kids, or transportation, or a gas card, doing other chores in the house, or maybe it's, there might be a dog at home and offering to dog sit, or giving respite. So maybe there's just a day that a heart mom or heart family needs to just relax for the weekend, and you're offering to take care of the baby or take care of the other kids just so they can have that time to rest for themselves. But there are practical things that are helpful, but it's good to keep in mind to offer that and not necessarily wait for them to ask. Second thing you can do is just provide emotional support. So a lot of heart families are, they struggle with how to explain what's going on with their heart warrior or with themselves and their experience. And you might have tons of questions, but we also want you to just listen without judging, their decisions for the medical experiences for their child. And you might have to respect boundaries. Be mindful. Are you asking too many questions? Are you asking too soon? I've seen so many families that struggle with when their child is in the hospital or having a surgery, and outside family members want to know what's going on. Give me an update. And that can be very triggering, because the heart families are already dealing with the stress of their child being in surgery, not knowing what's going to happen, just kind of waiting. And there's people on the outside who are kind of hounding them, like, give me an update. And they don't have an update sometimes. So just be mindful of the boundaries that heart families have. Maybe they don't want to talk about their heart warrior's condition. Maybe the heart warrior doesn't want them to talk about their condition. So be mindful of that. And the third thing is to be understanding and patient. So recognizing that parents of these heart warriors can have, remember I talked about the roller coaster of ups and downs of emotions, and recognizing that some days they might be really happy and everything's great, and things can drastically change because their heart warrior's health has changed, and they may not be feeling well. They may want to just isolate and stay home. And so recognizing that if they are pushing away or avoiding you, it may not be personal. It might just be their heart warrior is just not doing well. And last thing is educate yourself. So again, we don't always have time to answer all your questions about the heart warrior's condition. So we have to do the same thing for ourselves as heart parents, is we have to Google, or we have to ask the doctors. So I'm encouraging you to kind of remove that burden on the heart families to give you that information, and you go find it on your own. And if that takes you maybe going to events like this, or other events in the community, so you can educate yourself just overall about heart health, or maybe there's a specific diagnosis, that you can maybe search out other ways to support the heart families. And I want you all to remember that, yes, being a heart family and having relationship issues because of your heart warriors condition, it's very stressful. There's a lot of, I would call them unwanted emotions that we experience, but it's not all bad. Sometimes having these emotional struggles can lead to better outcomes. So, for example, with couples, those emotional roller coasters that you experience as individuals, if you're sharing with your partner, that can lead to a deeper connection with each other. So when we go through trauma, sometimes when we experience trauma together, it helps us connect with each other. So keep that in mind. And for single parents that are struggling with your emotional experiences, sometimes you learn how strong you are and how resilient you are. If you never had to go through your heart warriors journey with them, you may not have learned this about yourself. And for me personally, I never thought of myself as like resilient or strong because I didn't need to. But I've had so many people in my life who have pointed out, oh, you're so strong and you're so resilient. How did you go through all that? How do you deal with all that? And all I can say is just by the grace of God. I have no idea. But because I did it by myself, of course, my mom was there and I have friends that support me. But being the only parent in the room, I learned that I can do anything. And for siblings, sometimes, having a sibling with CHD, it can help you learn how to be empathetic at a very early age. And that is something that we all need to display in relationships. So when you have young children who have a sibling that's a heart warrior, teach them how to show empathy towards each other. That's going to go a long way in their future. So just a few key takeaways is, one, every heart family is unique. So yes, we may have very similar experiences, but we have very different needs. So if you know a heart family, be mindful of what does this particular family need and what does this individual in that family need. So sometimes you have to just ask the questions. So know that we are all different. And the second thing is support is crucial for every person in that heart warriors family. So if it's the couple, knowing that couples need each other and that they have their own individual needs for support. Maybe it's friends that maybe they can't talk to their partner about how they're feeling, but they'll talk to a friend or a therapist. And sometimes with single parents, if they don't have that support with, the child's parent not being there to support them, they need support outside of the family or outside of their friendships. And that support system can also include medical providers. It can include extended family members or their friends. And overall, with any relationship, so not just in heart families, communication is key. So make sure you are communicating, that you're showing empathy, and know that that can go a long way. And I just want to leave you all with this, that we are all resilient. No matter what our experience has been, we have gone through some really tough times and we're still here. So with the right support and understanding and resources, we can thrive no matter what's going on in our life. And I will open it up for some Q&A.
Thank you so much. So while people are working on adding their questions to the Q&A, I have a question for you. So, and this kind of stems from having, I guess, meaningful experiences with all of your children, and kind of navigating where with your heart kiddo, a lot of that one-on-one time is spent in the hospital, is going to therapies or doctor's appointments. And then you have the other side of it with your other kids and you're trying to spend one-on-one time with them, but you realize, oh, we're going to the movies or we're going to the park. And then you have your heart kiddo who you're like, I guess, like, how do you balance making sure that your heart kiddo is kind of getting quality time along kind of with your other kids, I guess, instead of just like, we spend quality time at the doctor's office. Like, do we need to go to the movies or like kind of something like that? I guess navigating that aspect of it.
Yeah, I think it's really important to make sure that your heart warrior feels as normal as possible and included in all the activities. So if there's a family with other siblings, trying to find events that your heart warrior can do too. So if it's about we're going to go to the park and maybe your heart warrior can't climb up the slide. Well, what can they do at the park? Is that a space that all the kids can enjoy and maybe help their heart warrior at that time?
Perfect. Yeah, I know that's like something I've been trying to balance when realizing, oh, we should probably take you to do something other than going to a doctor's appointment.
Yeah.
Um, we haven't had any other questions come in yet. Um, in
And
terms
can I add to
of,
that real quick? I just thought of
yeah,
something. There's the Make-A-Wish Foundation. So that is an excellent resource to use if that's catered to the heart warrior and what they want, where the whole family can participate in that, but it's focused on the heart warrior and their wish. So if you haven't experienced a Make-A-Wish trip or whatever they decide to do, like I highly recommend it. We had one. We went to San Diego for a week, and it was a very memorable experience.
yeah, and I know sometimes with a Make-A-Wish, depending on the heart condition, sometimes they don't qualify. So what we like to tell parents is like look in your state for other wish organizations because there's a lot of times there's other organizations that also do like wishes that kind of have a broader expanse or solely focus on heart kiddos or other things. Um, and like if they want to, like Disney World comes to mind because we just went to Disney World with our kids, but Give Kids the World is where those kids go for Make-A-Wish, and they actually have a list of organizations that partner with them, and they break it up by state. So with Make-A-Wish, maybe you don't qualify because of your heart defect with them, you might be able to qualify for like another organization too. So just
Well,
to kind of help to make those memories. So. Yeah. I know one thing that we try and do with our kiddos is we rotate and they get one-on-one time with each parent. And it rotates like every other weekend to kind of facilitate what that child wants to do. And usually they have a budget. But that's one way we've kind of figured out how to navigate the sibling aspect of it, which I think is really big.
mhm.
Um,
I was going to
okay.
ask
Yeah,
Carissa
go. Yeah.
as people still kind of formulate their questions, but I think one thing that you touched on a little bit, Dr. Davis, but I know comes up a lot is like kind of similar to your question, Carissa, but like how do you find time if you do have a partner to like also step away and, not constantly talk about your heart warrior. I think just like as parents alone, we find that when we're with our spouses and partners, like you can get so wrapped up in your kids that you like forget to be people. So, like, do you have any recommendations about how to like, let's take time as a couple or like, let's like revisit our relationship outside of being medical parents?
Yeah.
And like, what does that, what are ways we can like work better on that?
Yeah, I am a big fan of relationship conversation cards. And there's a lot of different types of cards, but they will force you to talk about things that you don't normally talk about. And it's not pressured because you're not the one asking the question. It's like whatever's on the card, that's what you have to deal with. But it does lead to deeper connection and sometimes like deeper conversations that you may have always wanted to have and you just never hadn't had the opportunity to do it. And sometimes if you think about hospital stays, you're there for a very long time with nothing to do but listen to the beeping and checking on the baby. And so those are actually some great times to pull away and let's say, let's play this game while we're in the room. Yeah.
I think that's such a great suggestion of like, because sometimes you're like, I don't even know what to talk to you about right now, other than like what's presently in front of me and stressful. And I can imagine that would also be a great thing to do, even if you didn't have a significant other, but just like, how can I just spend time with like a friend or another family member, um, and have some focus on something else? Because I think it gets really exhausting constantly talking about, as you mentioned
Absolutely.
your or your child's heart condition. And that breaking it up. And I think game playing is like such a great way to go about that.
Yeah, you just gave me an idea. I do have a relationship conversation cards for people like in their first year of dating. It's called the first year, but maybe I'll make a deck for heart families specifically. I think that might be interesting.
I think that'd be
That'd be
great.
really cool.
Yeah.
Yeah.
I was thinking about like support in general and having like, spousal support, but if you're single, like having that friend support. And I was thinking about this group of moms that I get together with quite frequently. And we spend the first 5 minutes giving a brief update on our heart kiddo, and then we talk about whatever else.
I like that.
So we do that. We'll give a brief update on what's going on, what we have coming up, but then we focus on like, what are you doing this summer? Do we want to get the families together? Like any upcoming trips or things like that, just to kind of get out of the mindset. Yes, we are all heart parents, but we're also human beings as well. And I think
Mhm.
that has kind of really helped us, one, grow with our relationships with other people, and to not solely be focused on like our kids and what they're going through medically, but also giving us that space to just kind of be ourselves in that time.
Yeah, it's you're making me go back in time with my experiences. Because I remember when my son was younger. So if you think about, if you're being a new mom and you're talking to other new moms and you're like, oh, my baby's doing this, they're crawling, and how old was your baby when they did this? And that was one of the hardest parts for me, is because my son's development was so behind because of all the surgeries he had. There were kids that were walking and he wasn't even crawling yet because he didn't have the strength. So people would say, oh, my kid is doing this. And I'm like, oh, I haven't had that experience yet. Oh, that's what's supposed to happen. I'm a new mom as well, first time mom. So I didn't know what to expect. And my child's not doing these things. And it brought concern that I didn't know I needed to be concerned about. So, yeah.
We have a question, and this is a great one. So it's, how can you encourage your non-heart friends to not focus on you as a heart mom and just a friend? I've actually heard this quite often, is like, how do you navigate kind of those friend relationships where like they might always be asking about your heart kiddo?
That is an interesting question, and I'm not sure how to answer it other than maybe what I would want to see. Um, it's hard to separate that because being a heart mom, like that is part of your identity too. So it's hard to not talk about your needs as a heart mom without talking about your heart kiddo, right? But I think one thing that would help is if you do have things outside of being a parent that's important to you. So if you have a hobby that you're interested in, or if you have a business or whatever your career field is, and talk about those things, that can lead to different conversations that aren't necessarily about your heart warrior.
I also think, I mean, correct me if I'm wrong, Dr. Davis, but I feel like even just saying like, you know what, I'm feeling like a lot of emotions talking about my heart kid. Like, let me tell you about this really cool restaurant I just went to last week or something. Like, I feel like it's okay for us to say that,
Absolutely.
right? Like that we're just like, I've talked about this all day long. Like, can we chat about something else? And I think people will respect that boundary, even though I know it's so hard to set that.
You said the key word, boundaries. So knowing that that is a boundary for yourself is important. Like, I don't want to talk about that, and being able to communicate, this is a boundary. I'll talk about it for a few minutes. I'll give you an update, but that's it. Or I don't want to talk about that at all. Let's just be normal friends and let's talk about you, for example. Let's not talk about me right now. Yeah.
Yeah. I also see kind of an evolution. So in the early time, especially if you have like a brand new baby and this like CHD is new, that's a lot of what they want to talk about. But I've seen that as my son has gotten older, they don't ask a lot about his CHD anymore. They know he's had surgery, they know he like does things, but that's kind of not their sole focus on questions. So I think there's also kind of this evolution on, if it's like new and fresh, they
Mhm.
may ask. And so it's like Sydney kind of put, like putting those boundaries there. Like if you don't want to talk about it, then you can say that. Like, I'm not ready to talk about it, or I don't want to do that today. So yeah. Um, from another friend, what is the best way to communicate to friends and family that their help is unhelpful? For example, when sharing medical updates, we tend to get a lot of responses to positive news, but then the hard stuff is ignored. Or I get a lot of stay positive, be strong when I just want someone to acknowledge that this is hard and be in the hard with me. Not sure how to give that feedback.
Yeah, I think kind of what we're talking about is just being honest about what you need and being upfront about that is totally fine. Like if you're getting responses that are not helpful, you have to sometimes tell people exactly what you need from them. And they may take offense to that because they're trying to help and be supportive and they may not feel that you're accepting their support, but sometimes it's more helpful if you guide them in the ways that you need to be supported. So if you just need to be direct about, I need acceptance in this experience. I don't need your encouragement right now, or I just need you to listen to me. And that happens in couples too. We need to tell our partners, just listen to me right now. And so for the people on the outside, like if it's the friend, maybe considering asking, well, what do you need? Do you want me to just listen right now? Or do you want me to encourage you? Do you want me to help you with something? Do you need advice? And so we have to sometimes take ownership in getting what we need by saying exactly what we need and not feeling guilty about it.
Yeah, I think that's the biggest thing that I've encountered when talking to friends is sometimes I'll just preface like, I need to get this off my chest. I don't need you to say anything. I just need you to listen. Um, yeah, because I think that can be just being honest and what you need can be helpful. And it's hard. I am definitely a very much an introverted person, but I've come to realize that if I don't include those things when I'm talking to people, I will get the, oh, but you're so positive all the time, or you got this. And it's like, really, I don't right now. So,
And it's also maybe interesting and it can change the dynamics when you share what it feels like to get the encouragement when that's not what you need. So if getting encouragement is it rubs you the wrong way because that's not what you need the moment, sharing like this doesn't feel comfortable, that's not what I need right now, or when you're encouraging me and I feel bad about myself, that actually hurts more than the person that's trying to give that will understand, oh, I was trying to help but I didn't realize that wasn't helping you, because they can understand the pain that's there, that's behind what you're experiencing. That was a good question.
Yeah, that's a great question. What do you think about, when you are navigating a complicated relationship with the other parent who may not be your partner? You're both co-parenting in a sense, but there's a complicated sort of dynamic at play. Like what are like helpful phrases or like questions or ways to like keep them involved at the right distance, I guess. Like maybe talk a little more about that of like what are some phrases you've used to say like, hey, here's what's happening, or hey, I need your kind of input on this.
Mm-hmm. So especially if there's a parent that could be, let's say, violent or um, just emotionally toxic, you do have to be very careful with how you're sharing information because sometimes it can be used against you. If you're the parent that's more involved in your child's health, sometimes you get blamed. Well, this all happened because of you. And so knowing what your boundary is when you're experiencing the toxic responses from that other parent, knowing when maybe you don't need to share so much with them, or maybe you need to share information with their family instead of with the parent directly, and they can kind of pass the information along. That is sometimes helpful. Sometimes the grandparents might be the middleman that you have to use, or if there's another friend that you both trust, like, hey, can you let so and so know this is what's going on and this is what we're about to do, because I don't feel comfortable sharing this. And sometimes people will be willing to step up and be that middle person for you. Sometimes if there's a parent who is wanting to be more involved, but they're just not making maybe educated decisions, that is hard. And so involving the doctors and the experts in the room is helpful. So maybe sharing together, hey, this is what I think is the best thing to do. And then the other person is able to share what they think is the best thing to do. But the doctor can say, well, if we do this, this is what could happen. And the doctor can say, well, if we do this, this is what can happen. So let's make the best decision for the child, not what we want for ourselves.
Yeah, that makes sense, right? Like you're adding that complicating layer, but like who is the neutral party who can kind of help facilitate that? Um, it is, I think, can be so helpful, in kind of finding who that is in your own situation.
Yeah.
One other thing I know we've talked about in the past, and I know you spoke on in one of our panels in the past, is also around kind of the opposite of Carissa's earlier question, like helping to boundary set for your heart warrior too, and like what is that dynamic? Because I know, heart warriors get or heart kids get a ton of attention, right? Even though you're at the doctor a lot or you have lots of procedures or checkups, like to other siblings that may feel like they're getting all this attention. Um, and then it also feels like, I think from the parent perspective, like I want to give my heart kid like everything always. Like I want them to eat ice cream for breakfast every day because I'm just so like happy that they're alive. But that's
Mhm.
like not great for them growing up thinking like, oh, well, I can just eat ice cream for breakfast every day forever. So I think that's also a piece of like the family dynamic, right? Like helping setting healthy boundaries for hard kids and those siblings as well. Like, what are some recommendations you maybe have around navigating that kind of parent-child dynamic?
Yeah. One thing that came to mind when you were talking about that is when we see the heart warrior kind of withdraw, and we might think, oh, well, maybe they're depressed or maybe they're angry about something. And it is just they're feeling overwhelmed with all the attention that they receive, or they don't know, they're confused themselves about what's going on with their bodies. And so we have to just be mindful and really pay attention to their body cues. Like if we're forcing them to do something and they're uncomfortable with it, I'm guilty of that, where I'm like, you need to learn how to go down the slide. Let's do it. Like pushing my child to do the things that we would consider to be normal things to do when they're not ready for that. And teaching our heart warriors to speak up for themselves is so important. We don't always allow that because we think as parents, we know what's best for them. And we try to overstep what their desires are and what their wishes are. But we also need to learn to incorporate them in the decisions that we're making about their lives. And for siblings that are involved in that, maybe we need to facilitate healthier communication as siblings, just in general. Maybe having discussions like, let's ask questions, or let's just share something about ourselves today. And everyone gets to do that, where it's not just the focus on the heart warrior at the time. Yeah.
I was thinking we were trying to get our son to go on a roller coaster at Disney World a couple weeks ago, and he was like, I don't want to do it. I was like, it'll be so much fun, do it. And we got right up there, and all of a sudden, I just like his body language told me, I just need to take him away. Like, this is not something that he's ready for, and that's okay. Like,
Okay.
and so I think recognizing those things as parents is you want them to have these experiences in their life and like to enjoy things, but then like realizing like it's okay for them to have boundaries and we need to like recognize those and be supportive in that. Cause he was like, I'm so sorry. I was like, it's totally fine. Like
Mhm.
you weren't ready yet. So
And one thing I did not include in the presentation, but I think is important to bring up, is our relationship with our heart warriors as parents, especially as they get older. Because I've seen in some of the heart groups that I'm a part of where the heart warrior will turn 18 and then they separate from their families because they don't want to deal with the pressure of, being asked, did you take your medication today? Are you going to go to the doctor? And they want to be able to be independent and do things on their own, but at the same time, they're exhausted from all the stress that parents have that they put on their heart warrior. And so what we don't want to see is that our heart warrior, gets older and becomes an adult and just completely isolates themselves from their support network. So family, your parents, we've been there, right? Like the moms and dads, we've been there the whole time. We know your health history. You know, you probably don't know all the things about your surgeries. We don't want to see adult heart warriors separate from that support that they need for the rest of their life.
Yeah, and I think that's a whole other topic in and of itself. Like I talk with adult patients all the time who are like, oh yeah, like at first, some of them at first there was like it was really weird. I wanted my mom to like go with me until I was like 25, and some people are like, no, I pieced out. And so I think as like a heart mom who's like, my kid's 10 years away from graduating and being on his own, but in my mind I'm like, am I going to be ready to like have that separation? And so
Mm.
I think that's another topic that we can discuss at like another time is
Okay.
how do parents prepare to allow their kids to take over their own medical care? Because we see like even now at 12 in a lot of states, you start losing access to some of their health records.
Yeah.
A lot of times they start going into appointments by themselves or having those private conversations. And that as they get older, that just increases that like lack of visibility and lack of like participation as a parent when you've been there since day one.
Yeah. It's
So,
scary. It's scary and it's not comfortable at all. Yeah.
yeah, it's an interesting dynamic that I think like a lot of parents are kind of starting to realize like at some point this is going to happen and how to kind of navigate that space. I would love to discuss that more at some in like another webinar or something about how we as parents pass the torch at some point. So,
I think there's some, I don't know how it is across the country, but I know at Children's Hospital and I believe at Cardinal Glennon in St. Louis that they have programs now to help like maybe starting around 16 or 17, helping them understand their condition and
mhm.
they do start to transfer the questions to the heart warrior and they don't look at the parent anymore, to
Yeah.
help them learn that yeah they can speak up for themselves and how important that's going to be so they get more comfortable while the parent is still allowed to be in the room. So I don't know how that is across the country, but I'd be interested to see that.
Yeah, I know a lot of centers are starting to build kind of these transition programs, and Conquering CHD actually has a PDF like printable guide for teens that kind of helps them start through that process. But I definitely think there's a dynamic where the parents aren't ready to give that up.
Mhm.
So, and to kind of navigate that space. So,
Yeah,
yeah, we need a guide for parents.
for sure.
How to go through that. That's all the questions that have come in. We just have one more comment that says, "Thank you for being encouraging for an encouraging and helpful presentation. I wish I had known some of the challenges of single parents of Heart Warriors as someone who provides support to a Heart Warrior family. Excellent presentation." So I thought that was good too. I
That's
never
my mom.
mom support.
Yeah, that's the other Dr. Davis.
I love it.
Yeah.
I like personally, I have seen like the single parent side of things, but I've never had to experience it. So I'm grateful to kind of see that side of it too, as a lot of times I talk with patients and families who do kind of have that two parent system and not much of the single side of things. So it did open my mind as well on the support that they need and how to kind of help facilitate that.
Thanks for
Perfect.
having me.
Yeah, well, thank you everyone for coming. Our next webinar will actually be in April, and that webinar will be with CNOC, which is the Cardiac Neurodevelopment Outcomes Collaborative, but I know that we'll be working on another webinar with Ollie Hinkle as well sometime this year, so stay tuned for that. And thanks everyone for coming.
Thanks, guys. Thanks, Dr. Davis.